Welcome to Section 1, Understanding the Enterprise Wellness Landscape. In this section, we establish the landscape you are entering as an enterprise wellness professional. Before you can design a program, present a proposal, or manage a corporate relationship, you must understand the industry itself, who the key players are, how the market is structured, and why corporations invest in workforce wellness in the first place. This context is not optional background information. It is the foundation of your professional credibility. When you understand the business forces driving enterprise wellness, you speak with clarity and authority. That credibility shapes how clients perceive you from the very first conversation. Let's begin building that foundation. How we got here. The evolution of corporate wellness. Corporate wellness did not begin as the structured industry we see today. For much of the 20th century, employer health efforts were reactive and informal. Basic safety training, first aid response, or occasional awareness campaigns. The major shift occurred in the 1980s and 1990s when healthcare costs began rising sharply. Employers started recognizing that workforce health directly affected their financial performance. A healthier workforce meant fewer claims, lower absenteeism, and improved productivity. That realization transformed wellness from a courtesy into a financial strategy. External vendors entered the market, services expanded, and the industry matured into a proactive, data-driven system. Today, enterprise wellness represents a global market exceeding $60 billion and continues to grow. When you enter a corporate client meeting, you are stepping into that commercial ecosystem. Understanding its evolution strengthens your credibility and positions you as an informed professional. Vendor versus partner, the most important distinction in this field. Early in your enterprise wellness career, you must decide whether you will operate as a vendor or as a partner. Although these terms are often used interchangeably, they represent fundamentally different relationships. A vendor delivers a predefined service, perhaps a step challenge, a seminar, or a screening event, and the relationship ends when the contract concludes. A partner operates differently. A partner begins by listening and assessing the organization's needs, workforce profile, culture, and objectives. Programs are designed intentionally, outcomes are measured, and strategy evolves over time. Partners share accountability for results and remain engaged beyond a single transaction. Research consistently shows that organizations working with true wellness partners experience stronger participation, better outcomes, and higher renewal rates. From your first client conversation, position yourself as a strategic partner rather than a product provider. The Wellness Council of America professional fluency in enterprise wellness requires familiarity with industry frameworks, and one of the most recognized is WELCOA, the Wellness Council of America. WELCOA's Well Workplace model outlines 7 benchmarks that define program maturity and effectiveness. These benchmarks include leadership commitment, data collection, strategic planning, supportive environments, programming, and evaluation. Many human resource directors and benefits managers are already familiar with this framework. When you reference WELCOA benchmarks in proposals or discussions, you demonstrate that you understand established best practices. This immediately elevates your credibility. Instead of appearing as someone selling a wellness activity, you present yourself as a professional aligned with nationally recognized standards. Speaking the same language as your client builds trust quickly and positions you as a knowledgeable contributor within the enterprise wellness space. ACSM and HERO, 2 more frameworks you need to know. 2 additional organizations are essential to your professional toolkit. The American College of Sports Medicine, or ACSM, sets evidence-based guidelines for physical activity and maintains respected fitness credentials. If your programming includes movement, exercise prescription, or on-site fitness initiatives, ACSM standards provide your scientific foundation. Their credentials are widely recognized in corporate health environments. Equally important is HERO, the Health Enhancement Research Organization. HERO focuses on research and financial outcomes, connecting wellness design directly to return on investment. Their HERO scorecard allows employers to benchmark their programs against industry peers. When speaking with finance teams or executive leadership, HERO research supports your case with measurable data. ACSM establishes your exercise science credibility. HERO strengthens your financial and research credibility. Together, they reinforce your professional authority. NIOSH and Total Worker Health, the federal framework reshaping workforce well-being. Another influential framework is Total Worker Health, developed by the National Institute for Occupational Safety and Health. This model represents a broader shift in how workforce well-being is understood. Rather than separating occupational safety from health promotion, Total Worker Health integrates them. It recognizes that working conditions affect health and health affects performance and safety. Mental health, job design, environmental exposure, and organizational culture all become part of the conversation. Many forward-thinking corporations are adopting this integrated approach, particularly in industries with higher occupational risk. When clients reference Total Worker Health, they are signaling a sophisticated understanding of well-being. Meeting them at that level requires you to think beyond isolated wellness programs and toward a comprehensive culture of care that supports employees holistically. Designing for a workforce, not an individual enterprise. Wellness requires a fundamental mindset shift, especially if you come from individual coaching or training. In enterprise environments, you are not designing for one person at a time. You are designing for an entire workforce. Population health management provides the structure for doing this effectively. Health risk assessments and biometric screenings reveal aggregate risk patterns across the organization. Instead of focusing on individual cases, you analyze trends, where risk is concentrated, which conditions are most prevalent, and which segments require greater support. Resources are then allocated strategically across low, moderate, and high-risk groups. Data drives decision-making and prioritization. This analytical approach distinguishes enterprise wellness from individual coaching. Developing this population-level perspective is essential to designing scalable, sustainable, and impactful corporate wellness programs. In this section, you established the foundational context for enterprise wellness practice. You explored the historical and financial forces that shape the industry and learned why corporate investment in wellness continues to expand. You clarified the critical distinction between operating as a vendor and positioning yourself as a strategic partner. You became familiar with 4 influential frameworks: WELCOA, ACSM, HERO, and Total Worker Health that guide professional standards and industry conversations. Finally, you began developing a population health mindset, recognizing that enterprise wellness design operates at the workforce level rather than the individual level. This foundation prepares you for the next step. In Section 2, we move inside the organization itself to examine decision-makers, structures, and how enterprise wellness initiatives gain approval and support within corporate systems.